Hello and welcome. Today we're diving deep into a group of serious lung conditions closely linked to a common and preventable cause of smoking. We're talking about smoking-related interstitial lung diseases, or SRILDs. We'll explore what they are, how they develop, and what can be done to manage and prevent them. The primary culprit behind SRILDs is, unsurprisingly, cigarette smoking. The harmful chemicals and toxins inhaled during smoking cause direct damage to the lung tissue. While cigarette smoking is the dominant cause, exposure to other inhaled substances like certain dusts, fumes, and even e-cigarettes, especially with long-term use, can also contribute to the development or worsening of these conditions. The duration and intensity of smoking greatly influence the risk and severity of the disease. So, what exactly happens in the lungs? Think of your lungs as having tiny air sacs, called alveoli, where oxygen and carbon dioxide are exchanged. In SRILDs, chronic exposure to smoke leads to inflammation and injury within these air sacs and the surrounding tissues. This inflammation triggers an abnormal healing process, resulting in the deposition of scar tissue, also known as fibrosis. This scarring thickens the lung tissue, making it difficult for oxygen to pass into the bloodstream. As a result, the lungs become stiff and less efficient, leading to shortness of breath and other respiratory problems. Smoking-related interstitial lung diseases are a significant public health concern, particularly in populations with high rates of smoking. The exact prevalence is difficult to determine because SRILDs often overlap with other lung conditions and can be underdiagnosed. However, studies have shown a strong correlation between smoking history and the development of various interstitial lung diseases. The risk increases with the number of cigarettes smoked per day and the duration of smoking. Men and women can be affected equally, although some specific SRILDs may show a slight gender predisposition. The symptoms of SRILDs can develop gradually over time. One of the most common symptoms is shortness of breath, especially with exertion. A persistent dry cough is also a frequent complaint. As the disease progresses, individuals may experience fatigue, chest discomfort, and unintentional weight loss. In advanced stages, even simple activities like walking or talking can become difficult due to severe breathlessness. Clubbing of the fingers and toes, where the fingertips become widened and rounded, can also occur. Diagnosing SRILDs requires a comprehensive evaluation. It typically begins with a detailed medical history, including smoking habits and occupational exposures, followed by a physical examination. Pulmonary function tests are crucial to assess lung capacity and airflow. High-resolution computed tomography, or HCT, scans of the chest provide detailed images of the lung tissue, revealing characteristic patterns of scarring and inflammation. In some cases, a lung biopsy may be necessary to obtain a tissue sample for microscopic examination to confirm the diagnosis and differentiate between specific types of SRILDs. Bronchoscopy with bronchoalveolar lavage, a procedure where fluid is used to wash the airways, can also help in identifying inflammatory cells and ruling out other conditions. SRILs encompass several specific conditions, each with its own characteristics. Some of the most common include respiratory bronchiolitis, associated interstitial lung disease or ILD, which is often seen in younger smokers and is characterized by inflammation around the small airways. Desquamative interstitial pneumonia or DIPE, similar to RBILD but with more widespread alveolar filling. Pulmonary Langerhans cell histiocytosis, formerly known as Langerhans cell granulomatosis, involves abnormal proliferation of Langerhans cells in the lungs, primarily affecting smokers. Combined pulmonary fibrosis and emphysema, also known as CPFE, is a distinct syndrome characterized by the coexistence of emphysema, which is destruction of air sacs, and pulmonary fibrosis, or scarring, in the lungs. And finally, idiopathic pulmonary fibrosis, or IPF. While not exclusively smoking-related, smoking is a major risk factor and can accelerate its progression. Unfortunately, there is no cure for most SRILDs. The primary goals of treatment are to manage symptoms, slow down the progression of the disease, and improve quality of life. Smoking cessation is absolutely critical in the first step. Pulmonary rehabilitation programs can help improve exercise tolerance and breathing techniques. Oxygen therapy may be needed to supplement low blood oxygen levels, especially during exertion or at night. In some cases, medications such as corticosteroids or antifibrotic drugs may be prescribed to reduce inflammation or slow the progression of fibrosis. In severe cases, lung transplantation may be considered as a last resort. Prevention is the best medicine when it comes to SRILDs. The most effective way to prevent these conditions is to avoid smoking altogether. If you currently smoke, quitting is the single most important thing you can do for your lung health. Seek support from healthcare professionals, support groups, and smoking cessation programs to increase your chances of success. Avoid exposure to secondhand smoke and other inhaled irritants. Regular check-ups with your doctor, especially if you have a history of smoking, can help detect early signs of lung disease. The prognosis SR-ILDs varies depending on the specific type of disease, the severity of the condition, and the individual's response to treatment. Some SR-ILDs, such as RB-IIP, may improve with smoking cessation alone. However, others like PF tend to progress over time, leading to significant disability and reduced life expectancy. Recent research has focused on identifying biomarkers that can predict disease progression and response to therapy. Clinical trials are ongoing to evaluate new medications and treatment strategies for SR-ILDs. Advances in imaging techniques and molecular diagnostics are also improving our understanding of these complex lung diseases.